contributes to good or bad oral health? The environment, socioeconomic status, behavioral factors, education, health service access. Nationally, oral health receives less attention than general physical health does. The main point, oral health disparities in Appalachia. The ARC is the Appalachian Regional Commission. ARC advocates for the Appalachian region. ARC funds projects in the region and also increases job opportunities. Here's a screenshot of the ARC's webpage where I received my information on the oral health disparities in the Appalachian region. The Appalachian region is made up of 13 states. For the population in the Appalachian region, these are many of the oral health disparities they may face. Socioeconomic status, community, fluoridated water, the oral health workforce, dentist visits, insurance, and behavioral factors. Socioeconomic status, poverty equals lower oral health. The Appalachian region is characterized by high rates of poverty and unemployment. The area has low income. It also has a large rural population. Each of these is statistically related to oral health. Compared to the United States as a whole, twice as many people in this region live in rural areas. The region has a high number of uninsured persons. The area being rural leads to the workforce size and the number of dentist offices to be limited. This leads to dentists to have too many patients. The poverty rate in Appalachia exceeds the national average by 5% in 2008. Unemployment and lack of dental insurance. Due to poverty, dental care in this region is not of the same priority as medical care. This can be due to budget. Poverty plays a very huge role, in oral health. This is one of many reasons the Appalachian region has poor oral health overall. Poverty directly affects many aspects of a person's life. If a family has a hard time putting food on the table and paying the power bill, having dental insurance comes last. Communities in Appalachia as a whole face many barriers to oral health. Access to dental care, difficult for rural communities to recruit dentists. Many must go out of their way to seek treatment. Each of these can lead to big expensive problems, such as many people will end up going to the dentist and seeking dental treatments far away from where they live once they need to have teeth removed or to have fillings or instead of preventative measures. Fluoridated water was introduced as a way to prevent tooth decay. To this day, it is still the most effective method. It is inexpensive. Water fluoridation looks past socioeconomic, racial, ethnic, and differences in age groups. The best way of maintaining community oral health is through fluoridated water. Seawater naturally contains fluoride. In 2006, 69% of U.S. had access to fluoridated water. Public fluoridation among Appalachian states is high. 10 of the 13 is in the top 20 nationwide. Kentucky contains half of the Appalachian's distressed counties, but is still one of the highest in the region. Many people do not have access to or use public water. This population can be up to 44%. This is bigger in rural areas. Much of the Appalachian region has access to fluoridated water. Much of the region's public water is fluoridated water. However, many homes in the region do not use the public water. This is due in some cases to where they live. Many live in areas that cannot have access to public water. In some cases, many choose not to have public water. Some houses in the region still use well water. The oral health workforce. Compared to the nation, the Appalachian region has a lower dentist to population ratio. Communities in the region may have problems recruiting dentists. This is so for many reasons, some being the location, the number of clients one may have, and the lower pay in rural areas. For many new dentists, debt that occurred during school is a problem. The Appalachian region does not offer resources financially for the new dentists to pay off their debt. In the area of dentistry, there is not as much diversity, which can lead to not as many coming into a low-income rural area. There is also a shortage of dental hygienists compared to the population in the region. More dentists and hygienists are found in the metropolitan areas than non-metropolitan areas. This could lead to why metropolitan areas reported having better oral health. Dentist visits. In the study, 2/3 of the population in the Appalachian region reported visiting the dentist during 1997 through 2007. However, half of them reported this was due to tooth loss, and many of these issues were due to decay-related issues. According to the ARC, the population over a span of time did report going to the dentist, but it was due to the removal of teeth instead of the preventative measures. The community mostly comes to have teeth pulled instead of cleaned or filled. Insurance. Poverty equals fewer people having dental insurance. Dental insurance is not included in many medical insurance plans. Plans are high and copays are even higher for dental insurance. Many do not cover preventative measures such as cleanings or fillings. Many just cover having your teeth pulled. Behavioral factors. Many of the foods in the Appalachian region play a role in oral health. The same can be said as far as drinks. Sodas such as Mountain Dew play a huge role in the lives of many Appalachian families and leads to extremely poor oral health. Tobacco plays a role as well, such as chewing tobacco or cigarettes. Also, it's more highly accepted. As future social workers, there are many things that one can do in the Appalachian region to improve the oral health in the area. For starters, one can advocate to make sure that everyone in the communities in the Appalachian region has access to fluoridated water. Education also plays a big role to make sure that everyone is aware of the importance of oral hygiene. Incentives for dentists to work in the region also is extremely important. School services such as having more mobile buses to come to the school to educate the children on the importance of oral health and the importance of a healthy diet is important. Having a sliding scale community where people of poverty can have easy access to getting oral health treatments is also an option. Insurance benefits with both dental and medical insurance as a package is something that the community can do on a macro level to improve the oral health of the